Diagnosis according to Zhang organ patterns. We discuss etiology of spleen imbalances. The spleen and its partner organ, the stomach, are located in the middle of the body, both physically and energetically. Physically, the spleen and stomach occupy the middle jaw, which means that they are the central axle around which everything revolves. All movement of qi, blood, and fluids, and all communication between the body's lower and upper jaw have to pass through the middle jaw. The spleen sends its qi upwards and the stomach its qi downwards. If this mechanism is disrupted or gets blocked, it will have implications for the movement and communication of qi, blood, and fluids throughout the whole body. For example, the small intestine and large intestine are completely dependent on the stomach and spleen qi mechanism, and organs such as the lung are also dependent on the spleen, sending qi and qinye up to it. If the spleen is not able to perform its functions of transforming and transporting as it should, dampness will arise. Initially, the dampness will accumulate and stagnate in the middle jaw. This will inhibit the movement of qi through the middle jaw and can thus interfere with the functioning of many other organs, as well as their central role in the movement and transport of vital substances. The stomach and spleen, together with the kidneys and lung, are fundamental in the production of qi, blood, and qinye. The spleen transforms the food and beverages that are ingested, separating the pure qi aspects from the impure. The spleen then sends these pure aspects upwards to the upper jaw, while its partner organ, the stomach, sends the remaining dregs downwards for further transformation and finally expulsion from the body. If the spleen is weak, there will only be a limited production of qi, blood, and qinye. This will affect the whole body and all the other organs, as well as the movement, transformation, and transportation of these substances. It is said that the spleen detests dampness and that it prefers dryness. This means that the spleen's qi mechanism is easily disrupted when there is dampness. The dampness can be exogenous or it can be internally generated. Invasions of exogenous dampness are usually due to climatic influences, such as when a person spends time in a damp environment or is exposed to wet, humid weather. Invasions of exogenous dampness have traditionally been a major etiological factor in northwestern Europe because this area has a cold and humid climate. In the old days, these etiological factors were even more predominant due to poorer standards of housing. At the same time, a greater proportion of the population was employed in occupations where they were more exposed to the elements. Exogenous dampness is, however, still a problem despite the improvement in housing and changes in the labor market. This is because the air is still generally quite damp and humid, and people are exposed to the elements when cycling, walking, jogging, and so on. It is therefore important that people are properly dressed and that they quickly change into dry clothes if they get wet. Dampness can enter the body through the legs in channels. So people, especially women, should ensure that they are adequately clothed on their legs and wear appropriate footwear when it is cold and damp. Furthermore, living in buildings that have fungal infections, such as dry rot, can provoke or generate symptoms of dampness in some clients. Mold and other fungi will therefore often be considered to be a form of exogenous dampness. Dampness can also be internally generated. This will occur because there is spleen qi deficiency, and the spleen is unable to transform the food and liquids that have been consumed. The resulting dampness will then, in itself, further burden the spleen. Dampness can also arise from excessive consumption of foods and beverages that have a damp nature, such as dairy products, sweets, sugar, bananas, beer, and wheat flour. One of the tasks that spleen yang performs is that of transformation and transportation. If there is an excessive consumption of food and beverages that are cold, either in their energetic dynamic or in their temperature, this will strain the spleen yang. Therefore, an immoderate consumption of raw vegetables, salad, fruit, cold water, ice cream, and so on can have a negative effect on the spleen. It is especially detrimental for the spleen yang if cold water is drunk with meals. In general, the diet and the way it is eaten is the single most important factor in the development of spleen-related imbalances. People often eat and drink products that are too cold, both energetically and in their temperature, things that are too sweet, or foods that in themselves create dampness and phlegm. They eat food that is too coarse and raw. They eat too quickly, too much at a time, late at night, and food that is of poor quality. The tendency to have spleen qi deficiency and phlegm dampness is often initiated in the first years of a person's life. Giving a baby or a toddler the wrong diet or feeding them incorrectly can easily burden and weaken the spleen, which is not fully developed and therefore vulnerable. This will create a fundamental tendency to have spleen qi deficiency and for dampness and phlegm to form, which further compromises the spleen qi, creating a vicious circle. Although eating too much, too fast, and too late are often cited as causes of spleen and stomach imbalances, it is important to remember that eating too little will also damage spleen qi. Malnutrition due to starvation and hunger is not as big a problem in Northwestern Europe as it was historically. Nevertheless, it is still a problem when someone has an eating disorder, eats a strict diet, or eats a very one-sided diet. Furthermore, some people eat too much, but the food they eat is of very poor quality. All of these factors can lead to spleen qi deficiency. Unfortunately, many people who are overweight and go on strict diets quickly put on weight when they start eating normally again. This is because the strict diet will have weakened their stomach and spleen qi, and thereby led to the creation of dampness and phlegm. Patients who have a history of anorexia and bulimia will often have seriously damaged their spleen and stomach qi. This is due to the extreme malnutrition that is a consequence of their disorder, fundamentally weakening their spleen and stomach qi, but also the repeated and forced vomiting will disrupt the stomach and spleen qi mechanism, and these organs then have difficulty sending their qi in the right direction. Some forms of pharmaceutical medicine, for example, antibiotics, have a very cooling and dump-producing energy. The use of these medicines can therefore injure spleen yang. Spleen yang is supported by kidney yang and mingmen, but if these are weak, spleen yang will also become weakened and will not be able to fulfill its functions in relation to the transformation and transportation of qi and fluids in the body. If the spleen and stomach qi mechanism is to function optimally, it is important physically that there is an open passage through which qi can be sent up and down from the middle jaw. If the person sits with a twisted midriff or sits slouched and slumped in a chair, it will physically block the movement of qi. Physical activity and exercise help to support the circulation of qi in the middle jaw. Therefore, a person who leads a very sedentary life will tend towards having a stagnation of qi in the middle jaw. Worry, speculation, thinking too much, and studying can bind and stagnate the spleen's qi. This can lead to a weakening of the spleen qi. If a person reads, watches television, writes on the computer, surfs the internet, and so on, while they eat, it will weaken the spleen qi. This is because the spleen must use its qi to digest or separate the pure from the impure, both intellectually and physically. In general, studying and reading too much strains spleen qi and can lead to spleen qi deficiency. Chronic illnesses, physical overexertion of the body, and heavy bleeding or hemorrhaging can lead to spleen qi deficiency. This is because the spleen will have to overwork to create sufficient Qi qi to replenish the chronic deficiency condition. Thank you so much for your attention.